Books teach diseases, patients teach medicine. Clinical medicine is where those two worlds finally meet. One day, you're memorizing anatomy, physiology, pathology, and pharmacology. The next day, a real patient looks at you and asks, "What's wrong with me?" Suddenly, there are no multiple choice options, no highlighted textbook answers, and no lecturer guiding you toward the diagnosis. It's just you, your patient, and everything you've learned coming together in a completely different way. Now, here's the reality that surprises many students. The biggest mistake students make before entering the ward isn't forgetting anatomy or physiology. It's believing that good grades alone will make them good clinicians. The hospital plays by completely different rules, and if you don't understand those rules, your first clinical posting can become one of the most overwhelming experiences of your training. But it doesn't have to be that way, because in this lesson, I'm going to show you exactly what changes when you move from the preclinical years to the clinical years, how to develop the mindset of a clinician, and the common mistakes that hold many students back. By the end of this video, you'll know what to expect, how to prepare, and how to step onto the ward with confidence instead of fear. Welcome back to EliteMedicNexus. If you're about to begin your clinical years in medicine, nursing, pharmacy, physiotherapy, medical laboratory science, or any other healthcare profession, then this lesson is for you. For many students, the transition into clinical medicine feels like entering a completely new world. During the preclinical years, your focus is on building knowledge. You spend countless hours studying anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, and many other basic medical sciences. Success often depends on how well you understand concepts and how accurately you can recall information during examinations. But once you enter the clinical years, something fundamental changes. The goal is no longer simply to know medicine. The goal is to practice medicine. Now, this is where many students get confused. They continue studying exactly the same way they did before, expecting the same approach to produce the same results. Unfortunately, clinical medicine doesn't work like that. A patient doesn't walk into the hospital saying, "Good morning, doctor. I have acute appendicitis." Instead, the patient says, "Doctor, I have severe pain in my abdomen." Your responsibility is to discover why. And that is one of the biggest shifts you'll experience during your clinical training. Instead of memorizing isolated facts, you begin connecting everything you've learned into one complete picture. You think about the anatomy of the affected organ. You remember the normal physiology. You ask yourself what pathological process could explain the symptoms. You consider possible differential diagnoses. You decide what physical examination findings you should look for. You think about which investigations will help confirm your suspicion. And finally, you begin considering the appropriate management. Notice something important. All the subjects you studied separately during the preclinical years are no longer separate. They work together every time you assess a patient. That is why memorization alone is no longer enough. Clinical medicine requires understanding, reasoning, observation, communication, and decision-making. Another important change is that patients don't always present the way textbooks describe. Textbooks often present classic cases because they're easier to teach. Real patients are different. Some have unusual symptoms. Some have several diseases at the same time. Some struggle to explain exactly how they feel. Others may leave out important details unless you ask the right questions. Learning to work through uncertainty is part of becoming a clinician. So don't become discouraged if every diagnosis isn't immediately obvious. Even experienced doctors continue thinking carefully before reaching conclusions. Now let's talk about the biggest transformation you'll experience. Not in your books, but in your mind. You must begin thinking like a clinician. A clinician is not simply someone with medical knowledge. A clinician is a problem solver. Every patient is like a puzzle waiting to be solved. Each symptom is a clue. Each sign you discover during physical examination is another clue. Laboratory investigations provide more clues. Imaging studies provide additional clues. Your job is to bring all of those clues together until the entire picture begins to make sense. This process is called clinical reasoning. Rather than jumping straight to a diagnosis, you ask yourself important questions. What is happening? Why is it happening? What diseases could explain these findings? What evidence supports my diagnosis? What evidence argues against it? Could there be another explanation? Developing this way of thinking takes time, and that's perfectly normal. The more patients you see, the stronger your clinical reasoning becomes. But here's something equally important. Never forget that you're treating a person, not just a disease. Two patients may have exactly the same medical condition, yet their situations can be completely different. One may have strong family support. Another may live alone. One may afford treatment easily. Another may struggle financially. One may understand their illness. Another may be frightened and confused. Patient-centered care means seeing beyond the diagnosis and understanding the individual sitting in front of you. Compassion is just as important as competence. Professional responsibility also becomes part of your daily life. Being punctual, dressing appropriately, maintaining patient confidentiality, introducing yourself respectfully, protecting patient dignity during examinations, speaking politely to patients and colleagues. These are not small details. These are the habits that define excellent healthcare professionals. If you found value in this lesson so far, take a moment to like this video, subscribe to EliteMedicNexus, and share it with your classmates. As we continue this Clinical Foundations series, we're going to build the confidence and clinical thinking every healthcare student needs before stepping onto the ward. Now let's look at some common mistakes many new clinical students make, so you can avoid them from the very beginning. The first mistake is poor history taking. Many students become so focused on asking every question on their checklist that they forget to actually listen. Patients often tell you the diagnosis through their story, but you'll only recognize it if you pay close attention. Good history taking isn't about asking more questions. It's about asking the right questions and listening carefully to every answer. The second mistake is rushing to a diagnosis. You hear one symptom and immediately decide what the disease must be. That's a dangerous habit. Good clinicians collect enough information before making conclusions. They remain open to different possibilities until the evidence becomes clear. Another common mistake is ignoring professionalism. Some students arrive late for ward rounds. Others forget to introduce themselves before speaking with patients. Some use their phones during teaching sessions or interrupt senior clinicians unnecessarily. These behaviors may seem minor, but they create lasting impressions. Professionalism begins long before graduation. Weak communication is another challenge. Clinical medicine is a team effort. Every day you'll communicate with patients, relatives, nurses, doctors, pharmacists, physiotherapists, laboratory scientists, radiographers, and many other healthcare professionals. Clear, respectful communication improves teamwork and ultimately improves patient care. Another mistake is not practicing consistently. Clinical skills cannot be mastered by reading alone. You become better by clerking patients, by performing physical examinations under supervision, by presenting cases, by discussing diagnoses, by making mistakes, receiving feedback, and improving each day. Finally, never be afraid to ask questions. Many students stay silent because they worry they'll sound unintelligent. In reality, asking thoughtful questions shows curiosity, humility, and a genuine desire to learn. Every consultant you admire today once stood exactly where you are now. They were beginners too. As we bring this lesson to a close, remember that entering your clinical years isn't simply about moving into a new class or a different hospital environment. It's about becoming a different kind of learner. You're moving from memorizing information to applying knowledge, from studying diseases to caring for people, from answering examination questions to solving real clinical problems. If you remember nothing else from today's lesson, remember these 3 principles. Build understanding, not just memory. Think like a clinician, not just a student, and treat every patient with competence, compassion, dignity, and respect. In our next lesson in this Clinical Foundations series, we'll explore hospital etiquette and professionalism. We'll discuss exactly how to conduct yourself on the ward, how to interact professionally with patients and healthcare workers, and how to make an excellent first impression from your very first clinical posting. If you enjoyed this lesson, subscribe to EliteMedicNexus, give this video a thumbs up, and share it with your classmates. I'd also love to hear from you in the comments. What part of starting your clinical years makes you feel most anxious or excited? Thank you so much for watching. Keep learning, keep asking questions, keep practicing, and I'll see you in the next lesson.